To formally diagnose prostate cancer, you need to have a test called a prostate biopsy. Now that involves usually going to your local hospital. You go to the day unit there because it is a day case procedure. You'll be seen and examined by a doctor, and he'll examine your prostate. He will then insert what we call an ultrasound probe into your prostate, and that allows you to visualize the prostate just like a baby scan. And indeed, we can then inject local anesthetic around the prostate to minimize the discomfort of having the biopsies taken. And in general, we take between 10 and 12 biopsies, 5 or 6 biopsies on each side of the prostate, so that we get a general spread of biopsy through the prostate, and that's particularly important when we can't feel the cancer. If there's an obvious cancer there, or if there's something that we see on the scan, we'll obviously direct the biopsies directly to that area. Once you've had that done, you'll be taken out to the recovery ward, because one of the risks of prostate biopsy is that you might develop an infection. So we give you a lot of antibiotics, and you'll be kept there for about an hour or so to make sure that you're able to pass urine. Commonly, after you've had a biopsy done, you may pass a little bit of blood in the urine, and very often patients will get frightened by the fact that they produce blood in their semen. Now, this is a very self-limiting thing, and you need to know this so that you're not frightened by it afterwards. It takes approximately a week, maybe 10 days, to get the results of the biopsy back. And once we get the result of the biopsy, we can then look at various parameters on the biopsy, such as the grade and the staging of the prostate cancer through the biopsy. Now, grade is a thing that most patients wouldn't be aware of. But essentially, if you look at a cancer under a microscope, the cells are generally, in normal tissue, are lined up in an organized fashion. In cancers, that lining up process, the regularity of the cells, tends to be disrupted. And the best way to think of grade is to look at a regiment of soldiers walking down a street. If they're all marching in step and all uniform, then that is benign disease. If, however, a few of them are out of step, then that is what we call low-grade cancer. If, however, more of them are out of step and their uniforms are disheveled, then that is intermediate grade cancer. High-grade cancer is when the whole regiment is doing whatever it likes, walking out of step, and they all look disheveled, and that is the best way to think of it. The importance of grade in cancer is that the higher the grade, then the greater the risk that that cancer will get out of control and spread into your system. And it's particularly important in prostate cancer. We have a special grading system for prostate cancer, and it's called the Gleason scoring system. And essentially, it's a score of 1 to 5, ranging from good is 1, 5 is bad. And because not every prostate cancer contains a uniform appearance, often you will find that one area of a prostate cancer has 1 grade and another part of the prostate cancer has a 2nd grade, and therefore we add the 2 to find a Gleason score. And that is what is known as your Gleason score, and it ranges in terms of prostate biopsy from 6 to 10. A Gleason score of 10 is very bad cancer. A Gleason score of 6 is, if you like, good cancer. And the reason I say that is that Gleason scores of 6, prostate cancer with a Gleason score of 6, rarely causes rapid spread, and therefore rarely causes rapid cause of death, and therefore gives you plenty of time to decide whether or not you need treatment or not. Whereas if we found a Gleason score of 8, 9, or 10, we would be recommending immediate treatment.